Hi everyone, my name is Kate Morgan and I'm co-chief executive at Myoma Patients Europe. And I'm really happy to be speaking to you today at your event in Serbia about unmet need in access in Central and Eastern Europe, and just to raise awareness of some of the inequalities faced and the work that we're doing to address them. In this presentation, I aim to cover an overview of Myoma Patients Europe and the work that we do on access and inequalities, and just to provide an overview of some of the data that we have that shows you the inequalities that patients face on a day-to-day basis. I also want to just quickly touch upon the impact that this has on patients' quality of life and also on their families as well. And I also want to just outline some of the unmet need in myeloma from a Central and Eastern European perspective and some ideas on how we can collaborate to address them moving forward. Just to tell you a bit about Myoma Patients Europe, we're a network of 49 patient organisations operating in 31 European countries. And we provide our services to the community across 4 pillars. Firstly, we really aim to build the capacity and advocacy ability of the community to make sure that we have strong national advocates, as well as a strong European basis as well to promote good quality treatment and care for patients. We have a clinical science and medical education program where we attend the latest congresses in myeloma and really try to disseminate knowledge and information about the latest treatments and clinical trials in myeloma to the community. An area relevant to the topic today, and one which I oversee, is access, policy and regulatory. So we aim to get involved in the marketing authorization of new medicines and provide the patient perspective. We want to influence the policy environment to be the best it can be for patients. And also we aim to raise awareness and to develop solutions around access challenges that patients face. And that can be anything from early diagnosis through to access to the best treatment and care. Overarching everything is patient evidence. So through our patient evidence department, we run projects to seek the insights of different patients across Europe to make sure that we're getting data on the most relevant questions to them. And that data then underpins the discussions that we have with healthcare providers, authorities, researchers, to make sure that they know about the needs and wants of patients. And it also feeds into the rest of our programs at MPE to make sure that we're really driven by patients and their families. Central to our approach is evidence-based advocacy, and that's where the work that we do on access really comes into fruition. Before I tell you about the Myoma Access Atlas, which is our program on access and inequalities, I just wanted to cover why I think inequalities is important for organisations to address and the impact that this has on patients and their families. And so what we've highlighted within some of our work is that there are huge inequalities in access to medicines, both across Europe and within countries. And this can really impact on patient outcomes on a day-to-day basis, because if patients aren't getting the most relevant and up-to-date treatments and in the right order in a personalised way, that can really have an impact on the experience of patients in the day-to-day setting. They can also have an emotional impact. So I think it's very hard for patients and their families knowing that there are a lot of treatments that, I don't know, if you lived in America, for example, you might be able to access, such as the bispecifics and CAR-T. However, within some countries, these aren't available. And that can be really hard for patients to deal with, because the solutions or the treatments that you want to access may not be there. The quality of life impact of not receiving the treatments that you need can be quite profound as well. At MPE, we really advocate for personalised medicines to make sure that patients get the treatment they need to treat their myeloma, but also supportive care to make sure that they can live well with myeloma as well, and to make sure that they have access to palliative care and to clinical nurse specialists, and also end-of-life care is important as well for patients too. From my perspective, I think there's a huge ethical dilemma as well across Europe. because of the inequalities, because some patients in countries like Germany and Austria have access to all of the latest therapies. In other countries, they can't access these. And I think just from an ethical principle, it's very difficult to reconcile these differences with something that's appropriate for patients, because in my opinion, patients should have access to the highest quality of care no matter where they live. And finally, not receiving the highest standards of care can have social and economic outcomes, because patients may not be able to actively contribute to society through going to work, and it may also have an impact on their families and carers as well, because they have to provide unfunded care to their families. So I think these are kind of multifaceted issues that really need to be addressed and thought about, and inequalities need to be tackled. So going into the work that we do at Myeloma Patients Europe on access, I want to tell you about the Myoma Access Atlas, and this is the main programme that we have, and it's an online platform designed primarily for our members to help them understand the key differences across Europe in terms of access. We really want to provide evidence to ensure that our members can think about how their countries compare to others, and really sort of develop solutions to address some of these differences. The platform, so it displays relevant and comparative data between countries. So we have country-specific reimbursement profiles, which tell you about the treatments that are available and how your country compares to others. We also have data and statistics on healthcare system funding. And we try and provide sort of a regular news section around the latest developments in myeloma. Over the next few years, we really aim to develop the content of the website. So if anyone has any helpful feedback for us on what would be useful to include, we're always really willing to listen to that. And as well as providing interactive data outside of the web platform, we provide one-to-one support for our members to help them develop solutions to some of the challenges faced. And we promote regional collaboration of members. So we have a Central and Eastern European work group, for example, where we really promote dialogue between members to ensure that we're kind of collaborating to address some of the more complex issues. I just wanted to highlight some of the some examples of the data that we have. So these are two drug combinations in myeloma, and the maps show you the differences in Europe. So the first map is a drug called daratumumab, which is approved in a quadruple combination for newly diagnosed patients. And you can see in green where the drug combination is available. And in grey, you can see where it isn't. And a lot of the countries that don't have access to daratumumab in this setting up front are in Central and Eastern Europe, and it also includes the United Kingdom and Norway. And I think access to some of the drugs like daratumumab really up front can really help patients have a longer and sort of better quality of life. Sarclisa is the second combination, which is quite similar to daratumumab, and is given in the relapse setting in combination. And you can see again in green the countries where it's available, and in red where it's been rejected. And again, and in black, that's where it doesn't have marketing authorization. And again, you can see it's quite similar countries that don't have access to some of these additional combinations. So when you look at all of the data that we have on aggregate, and we've done this for all of the reimbursed therapies in myeloma, some of the key findings can be really helpful to drive our advocacy. So access to some CE countries, such as Slovenia, is in line with the best of Europe. And we see that countries like Germany and Austria have really good standards of care and have access to the majority of treatments. And the same can be said for Slovenia. However, many countries don't meet standards of care set out by EHA-ESMO, which are sort of best practice guidelines agreed by doctors. And the main reasons for this are differences in willingness and ability to pay, and in the next slide, I'll talk a wee bit more about some of the reasons behind these inequalities. Countries such as Bosnia are almost 10 years behind the standard of care elsewhere in Europe. So we know that they struggle with access to generic medicines such as lenalidomide and Velcade, which have been off patent in the country for a long time. And this is a key factor that we'd like to address. I think generally over time, we're seeing really positive improvements in better access to therapies. But with the ever-increasing pipeline in myeloma, we're seeing real big difference in sort of standards of care and approvals. In some countries, it's stalling, and that doesn't just apply in Central and Eastern Europe. It applies across the board, particularly in the heavily pre-treated setting where we need to come up with some sort of advocacy messages and strategies to address it. Many healthcare systems promote treatment in a one-size-fits-all way because that's how the treatments are approved. So you receive one treatment when you're diagnosed, and then when you relapse, you receive the next treatment, and so on. Whereas I think to optimize patient treatment and to make the best out of quality of life, you need to have treatments that really fit the needs of the patient. So if you have high risk myeloma, for example, having treatments that suit your disease is very important. So in terms of what we hear behind the reasons for these inequalities, I think I've touched on this a bit, but there are differences across the board as to willingness and ability to pay. And the myeloma pathway, because it's so complex and there are many new drugs being added to it all of the time in combination, and patients are receiving drugs on a continuous basis, it can be very, very expensive pathway overall. And how do countries pay for this if we're continuing to increase the cost? And I think the pathway, as I said before, many patients are being treated in a one-size-fits-all way. But there are lots of questions around how we optimally phase the treatments for different groups of patients and to make it cost-effective for healthcare systems. Drug pricing can seem quite arbitrary, in the prices can be very high and not necessarily related to the value of the medicine. And also with the cell and gene therapies like CAR-T, there are really big variations in the ability of countries to pay for these medicines and also to implement them in practice. Other things we've mapped through the Myoma Access Atlas are access to clinical trials. And this also shows that the variations in access to medicines and inequalities. So across the board, you can see that some countries in Central and Eastern Europe do really well. So Czech Republic, Poland have some of the highest access to trials in the region. And other evidence suggests that a lot of clinical development with industry is really focused on the big 5 countries, such as Germany, where they are almost guaranteed to get access and kind of are really focused around getting access. Our report also found that around 6% of global trials in the past 20 years opened in Central and Eastern Europe, which is quite low compared to the rest of Europe. And the main reasons behind this are very different depending on the country, but often relate to structural barriers, so slow regulatory environments, difficult political environments, lack of funding for research and development, and also workforce planning. So in Croatia, for example, it's often cited that there are limited access to sort of data analysts to run clinical trials. So yeah, it's very different depending on the country, but it's very interesting to kind of explore these issues and to think about solutions. Reimbursement decisions, so where treatments are available and the availability of what's determined as the standard of care really impact on trial launch too. So industry are unlikely to run a trial in a country where they don't think they're going to get reimbursement in the end, or where the standard of care isn't funded. So there are kind of multifactorial issues with access to clinical trials, and we've tried to address some of these in our report. And moving forward, we'd be keen to work with our members across the region to try and address some of the issues raised and to shine a light on them a bit further. Just before closing, I wanted to give you some examples of how we use the data that I've just presented to work with our members in the region. Some of the Atlas data we've used in discussions with health authorities. For example, in Poland, there were threats to remove daratumumab, Velcade, and dexamethasone from national funding, which happened almost overnight. And we worked with our members, the Carita Foundation, to write to the health authorities and the health minister to make the case for reinstating it and highlighting the importance to patients and how the country compared to others in terms of access to daratumumab. And through this collaborative work, we were able to reinstate daratumumab as a standard of care. In Poland as well, we've recently translated the trial report into Polish to highlight some of the issues faced in the comparison, and the Carita Foundation are currently using that within their advocacy to promote access to trials. And finally, we try and promote discussion events and webinars and discussions on some of the key topics highlighted to sort of promote information sharing and solution suggestions. So in terms of a conclusion, I just want to address some of the potential solutions and ideas that we have. I think collaboration is definitely key between Myeloma Patients Europe, our members, and also other stakeholders. And we really aim to continue the data collection that we've done through the Atlas, really build on it, and also to sort of strengthen the patient advocacy community across Europe through our capacity building programs to make sure that we're all well equipped to engage on some of these discussions around inequalities and how to address them. We'd also like to explore different and improved models and ways of pricing and reimbursement, because something isn't working in the system and we need to think about how we get these drugs to patients. We're currently working in a Horizon Europe project called Ascertain, which is looking at different ways of thinking about these problems and methods of developing sort of a fair price for different stakeholders. So hopefully we'll get some useful policy tools and suggestions through this programme. In addition, and this is an advocacy message we have with industry and other stakeholders, but I think industry really need to think about clinical development programmes that consider countries outside of the Big Five. Central and Eastern Europe is a huge part of Europe, and there are a lot of patients, and we need to think about how we open trials and get reimbursement for the medicines at the end to reduce the inequalities. To address some of the issues we have with the myeloma pathway in improving personalised medicines, we need to think about optimum treatment sequencing for different parts of Europe and how we make the best use of the treatments that we have currently on the market. And in the future, also thinking about access to diagnostics and risk testing in MRD testing will be important to improving personalised medicines and increasing the cost effectiveness of the myeloma pathway. Importantly, I think influencing EU policy is something that's definitely on the radar of Myeloma Patients Europe, and we're really developing the work that we do in this area to make sure that we highlight the inequalities and think about policy solutions, and also support our members to engage on national policy, because that's where a lot of the big decisions that impact on healthcare systems and access happen. So really kind of equipping our members with the ability to address these challenges with policymakers is important. And finally, and just to repeat what I've said at the start of the slide and earlier on in the presentation, but collaboration is definitely key. So working with members, but also all stakeholders to identify and address the problems is really kind of the key approach, and to make sure that we have discussions like the one today to identify some of the issues. So Thank you so much for listening, and I really hope the rest of your event goes really well. And I'm sorry I couldn't be there in person. Thank you.